Hi everyone, welcome to week 2 of your Pharmacology 2 course. This week we are focusing on neurological drugs. So neurological drugs are going to be those drugs that are used to treat different types of neurological diseases. So there's a lot of different things that fall into this category that might be maybe unusual to you. Some of them might be familiar. So let's just take a look at a little bit of some of those disease states, and then we'll look at some of the specific drugs used for those disease states. Some are going to be a lot more common than others, so I'll probably highlight a few of those. There's a lot of slides here, a lot of information in the textbook. So, I'm just going to touch on a few things just to remind you about them. So we're going to be looking at things that can be used to treat seizures, specifically epilepsy. We're going to be looking at things used to treat Parkinson's disease, Alzheimer's, dementia, multiple sclerosis, neuralgia and neuropathy, and insomnia. So it might seem that is a lot of categories that are all lumped together, but anything that's affecting the brain is what we're looking at. In addition, you're going to look at some of the difficulties that physicians face in treating the lack of dopamine that is part of Parkinson's disease. And then you need to just basically learn some of these brands of generics. So if you're given the generic, what's its trade and so on. So just knowing also what category they fall into and what disease state it's used to treat is also going to be important going forward, which is why you're doing those drug tests and stuff as well. And again, basically just being able to identify things and become more familiar and more comfortable with them. I think honestly, the best way to do that, obviously you can practice and memorize and all of that kind of stuff, but once you're actually out there working, you'll find that these come a lot easier as well. So the first thing you're going to be looking at is drugs that are used to treat epilepsy. So what is epilepsy? And this is just a little quick summary, and then there's a video after that you can watch. And it just kind of talks a little bit about what an epileptic seizure is, where it starts, which, of course, as we said, this is neurological drugs. So everything that we're talking about here are things that happen within the brain. And an epileptic seizure is specifically when a group of neurons spontaneously begin to send impulses in an abnormal, uncontrolled way. And that's pretty general. But that's kind of where we're at with epilepsy. We just don't know a whole lot about it, but we do know how to stop it. So that's what we want to look at is what are we going to do to treat epilepsy? We really want to treat it before we actually have a seizure. So some of the symptoms of a seizure, if you've never seen one, that staring or lack of attention, it's not always that muscle jerking, unconscious kind of flopping around thing, which is what a lot of people think of when they think of seizures. Not always like that. If it's a minor seizure, you're not necessarily going to see all of that. And again, it just depends on a lot of different things, how many neurons are affected and things like that. So basically what we want to do is address them with what we call an anticonvulsant. So epilepsy is a convulsion. So we want to treat it by using anticonvulsant drugs. So some of those drugs that you're going to see most commonly, Dilantin is probably one of the most common ones that I'm familiar with in the retail setting that is given. You're going to see a lot of other ones that are talked about in this section, and it has to do with how they actually act within the brain. So the Dilantin, this group of drugs, is acting on the cell membrane, and they affects a flow of sodium in and out of the cell. Whereas if you look at another group, the succinimide drugs, they depress the motor cortex and they raise the seizure threshold. So every one of these is going to be used in a little bit different way for a different result. Ultimately the same result, but what it's doing inside the brain is going to be a little bit different. So that's what all of them in this particular category are for. All of them are going to be for epilepsy. Some of them are going to just work differently within the brain. A big point here is to make sure that you don't get these look-alike, sound-alike drugs confused. Some of them are used for epilepsy, some of them are used for other things. And ultimately, the different choice of therapy is going to differ depending on where this seizure is originating from. What does the EEG tell us, and what does the doctor recommend? So the next category that you're going to be looking at is drugs that are used to treat Parkinson's. Dementia and Alzheimer's. So when we think of dementia and Alzheimer's, we think of someone who is older, right? Someone who's becoming senile, who's had some sort of brain trauma, that type of thing. It's the most common form of dementia. It is irreversible and it is progressive, which means that it's going to get worse. So somebody might be fine today and then tomorrow they don't recognize you, that kind of thing. That's what they're talking about here. And we don't know a ton about Alzheimer's. We know it's caused by some sort of destruction of neurons in the cerebral cortex and the hippocampus, but we don't know a whole lot. The levels of acetylcholine are reduced. We just have all kinds of just stuff going on that we just don't understand. So the loss of the neurons affect really memory, judgment, things like that. So the different drugs that we're going to use are going to be what we call cholinesterase inhibitor drugs. So that's the drugs that are going to break down that acetylcholine to help continue that. It's not going to it can't reverse things, but it can slow it down. So that's what we're going to focus on. So these are just some examples. Probably the one that I'm the most familiar with, the one that's used most often that I know of, is the donepezil, the Aricept. That's the one that I see used most frequently. But again, it just kind of depends on the doc and what they see going on. As far as what drug they're going to use. This one is another one that Namenda that's used fairly frequently as well. But again, it goes at it a different way. So that's why you're going to see different types of drugs. It's how is it being used within the brain. Then we're going to be looking at Parkinson's disease. It is a chronic degenerative brain disease caused by some sort of an imbalance between the dopamine and the acetylcholine. And that's just going to cause more and more symptoms. Some of those early symptoms include those tremors that you might be familiar with, slowing of your different voluntary movements, things like that. And then as it progresses, you're going to see things like resting tremors, drooling, they can't move around, things like that. So the different drugs are going to be broken up into two main groups: drugs that increase or enhance the action of dopamine and drugs that inhibit the action of the acetylcholine. So basically, we're trying to get a balance back is what we're trying to do with these drugs. So carbidopa drugs is the most common. There's, combination drugs that are used. Cimetrol is the one I'm see most often, along with Parladel. So those are the two that I have the most visibility to in the areas that I work. That's what most folks are using. But again, it just depends on what the doc sees and what they want the patient to have. And then, there's going to be a lot of other ones they're going to discuss in this section about Parkinson's, but just know that, those are just the ones I'm highlighting for you. MS is the next group. MS is an autoimmune disease. Basically, there is antibodies that are being built, are being made in your body that are going against the myelin covering around the nerve. So it interrupts that discussion between the nerve and the brain and the spinal cord. So some of the things you'll see is, uncoordinated gait, double vision, tremors, things like that. Again, a lot of different categories of drugs depending on how they want to, approach it. Probably the most common one that I've seen in this one is Imuran and Avonex. Those are pretty commonly used. And then they have, some things that are just, muscle relaxants, anti-anxiety drugs that are used. So Valium is an example of one that's used. So it just depends on, again, what exactly they're trying to treat with the medication as to which one the doctor chooses. Here's an example that you may not have ever have an idea that would be used to treat MS, and that's Botox. So again, just depends on the doctor and how they want to start treating it. And then we have neuralgia and neuropathy, which has to do with um, things like restless leg syndrome, um, other kinds of pain that is coming from maybe an amputation, things like that. Um, there's just so many things that kind of fall into this. Even those chronic pain that they can't really put their finger on is falls into um, this category. So just any kind of different nerve pain and things like that. Maybe neuropathy coming from your diabetes, all those types of things. And again, lots of different categories, things that are used. Probably one of the more common ones. And, you'll see a lot of antidepressants used for this. Tegretol, gabapentin, those are all some real big ones. Lyrica, you see those that advertised quite a bit. And then the last category that you're going to see in this chapter is drugs that are used to treat insomnia. Basically, that just means you can't fall asleep, right? Or waking up during the night and not being able to go back to sleep. And it can happen for a lot of different reasons, and they give you a few here: anxiety, stress, pain. So we're using a lot of different things depending on what the cause is. So you'll find that Ambien is in this group, Lunesta, and then Benadryl, melatonin, those types of things. So as you go through this week, if you have any problems or questions about any of the material that you're learning about, please make sure that you reach out to me, and have a great week.